Hello, this is Dr. Kavyan Milani for Virginia Medical Updates. As we discussed in our previous sessions, the whole issue of cholesterol and treatment of cholesterol has been a dilemma for medical practitioners and cardiologists for a long time. About 10 or 15 years ago, in general, treatment was to goal, like we'll treat the LDL to 130, or treat the LDL to 100, or treat the low LDL to 70. However, about 2 years ago, this paradigm shifted and changed with the emergence of new data that had been accumulated for the past 10 years. It was understood that treatment needs to now be confined to 4 groups of people. People that have diabetes, people that have had history of a heart or coronary event, people that have a 10-year risk factor, risk of about 7.5%, or people that have basically history of hypertension or disease. In general, that guideline was balanced by a newer guideline by the United States Preventive Task Force Services in November of 2016, which just came out. It turns out that in general, 4 groups of people need to be treated, but not to goal anymore. But these categories of people need to be treated. The category 1 is diabetics, people that smoke, people that have a risk of about 10% over the next 10 years of developing heart disease, or people with hypertension and heart disease. Basically, if these people are treated with low to moderate statins, like a pravastatin of 20 milligrams, like a Lipitor of 20 milligrams, of 10 milligrams, like a simvastatin of 20 milligrams, the outcomes do show significant improvement. And this is the way to treat this population. The goal, therefore, is not any longer to treat to a particular goal, but these categories of people, which includes people that have a smoke, diabetics, people that have heart disease, and people that have a risk factor of 10% over the next 10 years of developing heart disease, based on a heart calculator. The paradigm shift is pretty clear, and this is really a very interesting and very exciting time to be involved in treatment of lipids, because a whole new set of thinking has emerged and has really superseded the way we used to do things 3 or 4 or 5 years ago. And the emergence of and the possibility of treating with low-dose statins is incredible, because high-dose statins, like a Zocor simvastatin of 40, like a Lipitor of 80, like a Crestor of 20, they have side effects. So now we have the possibility of treating with medications that are much less toxic, cause less myelopathy, and are very, very well tolerated. So this is a great development. So in short, the evidence now suggests, based on 19 randomized trials, 17 of which was actually sponsored by industry, the pharmacological industry, statins themselves, that if we treat these 4 groups of people, smokers, diabetics, people with risk of 10% over the next 10 years, and people with heart disease, it turns out that we can make a significant change in their outcomes and improve their longevity and decrease all-cause mortality. So this is a great development, and the take-home message is this, that we don't treat numbers, we treat the appropriate patient. This is great news, and we look forward to have any questions or concerns addressed to us at Virginia Medical Updates. The take-home lesson here is that we treat not numbers, but we treat the appropriate patient.
Welcome to Virginia Medical Updates. My name is Alejandra Gonsalves. Today's topic is sleep. Today we have with us Dr. Hoffman. Thank you for being here with us today, Dr. Hoffman.
Pleasure.
Dr. Hoffman is a pulmonary and sleep medicine specialist with Sleep Centers of Northern Virginia and American Sleep Medicine. Dr. Hoffman is board certified with over 30 years of experience in sleep medicine, critical care medicine, pulmonary disease, and internal medicine. So again, today, Dr. Hoffman, we're going to be discussing sleep. So tell us, what is the importance of good sleep?
Well, defining the importance of good sleep is always a little difficult since we're not really sure why we even sleep to begin with.
Okay.
While there's lots of theories that are around, there's philosophical, physiological, psychological, and theological reasons. The real reason we sleep is yet to be clearly defined.
So it's not just basically getting some rest and resting your body.
No, and in fact, one of the most important things to think about sleep is that sleep is an active process.
Okay.
It is not just the absence of being awake, it is actually a very complicated physiological and psychological process that's necessary for us to get through our daily activities and daily living. The major theories of sleep involve the concept of restoration
Okay.
and consolidation. So the concept being that when you're in certain stages of sleep, your body is going through a healing process, it's going through a restorative process, it's clearing out the difficulties of the day that have accumulated, and in addition, when we're in other stages of sleep, our mind is going through both a restful phase, but also a phase where we're consolidating our thoughts and memories so that it can be used in a functional manner in the future.
Okay.
So the need for sleep is clear in that if you deprive people of sleep, or animals of sleep, or any organism of sleep, certain abnormalities will come into the system that are signs of sleep deprivation.
Okay. So I like that. It's basically an active form of something that you have to do throughout your day, basically. I like the way that you present that, because it is something that's not just, you just go to sleep and you're done for the day. No. Your body's still working for you.
Far from it. When you're sleeping, there's actually different levels and stages of sleep, typically labeled as what's called non-REM or rapid eye movement sleep,
Okay, yes.
which is the non-dream phase of sleep, and rapid eye movement sleep, which is typically thought of as the dream phase of sleep.
Okay.
During non-rapid eye movement sleep or non-REM sleep, these are stages typically 1, 2, and 3. The body is going through different levels of depth of sleep while the mind is at rest. During REM sleep, the mind is extremely active while the body is at rest.
Okay.
And both phases are necessary for productive, high-quality sleep.
Okay. So that's what would basically entail the good sleep that we would need.
Correct.
Okay.
To get good quality sleep, you need not just to have enough hours of sleep, but you also need to go into the deeper, again, more restorative phases of sleep, which are typically the stage 3 non-dream sleep or non-REM sleep, and a certain amount of REM sleep.
Okay, and that's what you said, when your body is at rest.
During non-REM sleep, the mind is at rest.
Okay.
The body is actually fairly active. We go through increased cellular turnover, healing functions increase. During REM sleep, the body becomes essentially immobile, partially so we don't act out our dreams, while our brain is extremely active and is almost as active as it is while awake.
Okay.
And during that phase, we're consolidating thoughts and memories, and again, going through a restorative function on our thought processes.
So really active, thing to be sleeping, really. You're not just,
Correct.
done out of there. Okay. And so obviously this is something that, your body has to be functioning well in order to have those processes working well. Are there some disorders that can occur?
Well, the major sleep disorders are broken down into things that occur before sleep,
Okay.
during sleep, and after sleep.
Okay.
The things that occur before sleep are things that people are usually aware of. The most common one is inadequate sleep syndrome. basically means you're not getting enough sleep because you're too busy with all the things going on in your life, and you've opted to try to cut down your sleep in order to get things done. Usually not a great idea.
So not having your bedtime or going to bed
We
each
know
night.
that not getting enough sleep is associated with increased errors at work, decreased both physical and psychological mistakes.
Okay.
It's associated with poor quality work, lower income. So just
Wow.
not getting enough sleep alone is associated, well, a lot of people are doing it so they think they can get more done, and there's evidence that they get less done and less done efficiently. Even people who say, I only need 4, 6 hours of sleep,
Right.
there's evidence that while individually as they may do as well as many people who get more sleep, within themselves they would function at a higher level if they were able to get more sleep. In other words, if they're functional at 4 hours of sleep, they'd be extremely successful if they would get more sleep in.
Okay, gotcha. And so that's actually, you said before going to sleep. What about during
Well,
sleep?
again, the other things about before going to sleep is obviously I just mentioned inadequate sleep syndrome, which is again just a nice way of medicalizing the concept you're not giving yourself enough time to sleep.
Okay.
Insomnia is probably the most common sleep disorder. Insomnia usually regards the inability to initiate or fall asleep.
Right.
There's a secondary form where if you wake up in the evening, difficulty falling back to sleep.
Okay.
Again, with both inadequate sleep syndrome and insomnia, the patients will tell you they're not getting enough sleep for one reason or another.
Okay.
Why someone has insomnia can be very complicated. It's often associated with underlying anxiety features, etc.
But it's something obviously that they're aware of.
They're usually aware of that. When a patient will come to you and say, I'm sleepy all the time, and you say, well, how do you get enough sleep? And they say, no, you're into those categories.
Okay.
Then you have the next phase of disorders where are the diseases that occur during sleep.
Okay.
These are often the most perplexing and also are extremely common. This is where you think you are sleeping. As far as you know, you're getting good quality sleep, but you're tired the next day.
Right.
And by tired, I want to specify sleepy as opposed to fatigued.
Okay.
So you're wanting to actually close your eyes and go to sleep despite what seems to be an adequate night's sleep.
Okay.
These are things such as sleep apnea and limb movement disorder, sleep apnea being the most common, limb movement disorder being fairly common but significantly less than sleep apnea.
Okay.
There's also disorders of sleep that interrupt your sleep where you are aware of interruption, you are waking up, you don't know why you're waking up. Again, sleep apnea, limb movement disorder can cause those types of problems.
Would wake you up out of your sleep.
Correct. You'll often wake up not knowing why you woke up because whatever behavior or physiological abnormality woke you up usually is gone by the time you arouse. So you wake up and say, why did I wake up? I don't know. And typically we'll try to go right back to sleep.
Okay. Yes.
Another group of disorders, the parasomnias. These are behavioral disorders in sleep where you're doing things that are either disturbing or worrisome, either to the patient or to the patient's family. And these are typically things such as sleepwalking, sleep talking, sleep eating, and this goes quite a bit. Night terrors, a large number of diseases in children, and there's some diseases in adults such as REM behavioral disorder where you actually don't rest your body during dream sleep and you get up and act out your dreams. And again, these things are usually dangerous in that you can do activities that put yourself in danger and of course disturbing to those people around you.
Okay.
And then the next group of disorders are the disorders where you actually do sleep, you're actually getting good quality sleep. But during the day, there's a signal from the brain to go to sleep at an inappropriate time.
Okay.
And these are things such as narcolepsy, which is
Yes,
probably
okay.
the best well known, and idiopathic hypersomnia. And there are several others. These are the most common disorders of each category.
Okay. So the disorder being actually that during the day or at the wrong time, you're feeling the
In
wanting to sleep.
narcolepsy, which is probably, even though there is some disruption of nighttime sleep associated, the primary problem is that during the day, the signal to the brain to go into dream sleep occurs at an inappropriate time.
Okay.
which results in a signal to sleep or become extremely tired. And also because I mentioned earlier during REM sleep, during dream sleep, normally there's a signal to stop moving your body so
Right.
you don't act out your dreams. This can occur in the middle of the day and you can suddenly lose movement during the day,
Oh, wow.
even though you're otherwise wide awake.
Wow, very interesting. So obviously things that either you're aware of yourself or some of your family members would help you, the snoring, the sleep
Correct.
apnea, like you said, if you're
Snoring
waking up.
and sleep apnea, and I know we're going to talk more about those later, is almost a spectrum of the same problem.
Okay.
And whether snoring is a disease or whether it's a normal function depends on who you speak to.
Right.
But sleep apnea being at the far end. Many of the sleep disorders, the patients do have a low insight into. Patients, for example, with sleep apnea or any of the sleep disturbance disorders will often, when they're asked, are you sleepy, they feel they're not because they've had the disease for so long.
They're so
they
used to
feel
it.
what they're doing is normal, and only after you treat them do they recognize that the world they were seeing was not the world that's really there.
Right.
There are also patients who do sleep through some of their sleep disorders and will not be sleepy, but the consequences of, let's say, sleep apnea, where you're not breathing in your sleep, can start damaging the heart, the lungs, increased risk of stroke, etc.
Okay, so obviously things that maybe through physicals or annual physicals, if you're not aware of it, it's something that should be discussed with your doctor.
It would usually be the type of thing where patients often will not bring these things up to their physicians unless they're asked.
Right.
So, for example, low libido is commonly associated with inadequate sleep, and patients will often fail to mention those things.
Right.
And again, often the patient will be asked, how do you sleep? They say, fine. If you say, are you sleepy during the day? They will then say, yes, I wake up, I'm still tired, I feel like, even though I slept fine,
Right.
I didn't feel like I got any sleep.
Okay, and so tell us a little bit about achieving that good sleep. What would be some tips that you would give in order to, make sure that we're getting those? Is it the recommended 7 to 8 hours?
Recommended 7 to 8.
Okay.
Most of the world does 7 hours with an hour sleep nap in the afternoon. In the U.S., we frown on that. And
No nap, I know,
and
right? It would be great.
Naps are actually physiologically normal, but we tend to force them out of our schedule. Pretty much we see when someone's functioning is being tested for errors and mistakes and functioning levels. Usually around 8 hours, 7 to 8 hours sleep is necessary.
Okay.
9 is helpful for some people, but once you get much beyond that, it usually doesn't help. But it's not just the amount of sleep. You also have to go into the different stages of sleep.
Right.
So if you are, for example, I'll go back to sleep apnea again. If you have sleep apnea that occurs more in dream sleep than in other phases of sleep, such that you don't enter dream sleep or stay in dream sleep, your sleep will not be restorative. You'll
Right.
wake up with dysfunction similar to not getting enough sleep.
Right. So you can have the time, the hours there, but of course it's not going to do anything for you unless you get that sleep apnea treated.
For healthy sleep, you need to have no disorders that prevent you from going into the deeper stages of sleep. And there's the ones we mentioned are a small number of the numbers that are out there.
Okay.
Again, the quality of sleep can also depend on the timing of sleep. Some people will sleep normally, but in a different time phase from what society demands.
Okay.
Some people will go to sleep very early and want to wake up what would be abnormally early. Other people will want to be a night owl and stay up very late and sleep in very late. And while that might be your own biological clock and circadian rhythm, not a disorder.
Right.
Because your job demands don't allow you to sleep under that schedule, you try to force yourself into what for your body is an abnormal schedule. And again, you end up ultimately sleep deprived as a result.
Okay, so obviously watching our own bodies and making sure that we know exactly what's needed and feeling whether or not we are having that sleepiness and not just the fatigue. So
you have to look out for, again, fatigue. I like to differentiate. When someone says to their doctor, I'm tired,
Yes.
comes to my office says, I'm tired, they can mean different things, and you have to break it down. You have to
Right.
find out if they're sleepy, which means they want to sit down, close their eyes, and go to sleep. Or fatigue, which means they want to sit down, kind of relax in the chair, but not necessarily go to sleep.
Not exactly tired. Okay.
And tired will be used to describe both by most patients. So
Okay,
you have to
so
break it down because that can guide you to decide a certain number of diseases cause fatigue without causing sleepiness. Those are not the classic sleep disorders.
Okay.
A large number of diseases will cause sleepiness without, and most of those will also cause fatigue.
Okay, so
You've
obviously a
gotta
lot
put
of
them together.
details into it, but I think it's probably best to obviously, like I said, recognize in yourself what it is that is best for you. If you're feeling any type of, something that's wrong throughout your day where you're having that tiredness, but trying to achieve those hours. So
Again, insight into it can be very difficult.
right.
For many of the signs of sleep deprivation, we've talked about being sleepy or quote, tired. But that's not all there is to it. Some patients' sleepiness will manifest or sleep deficit will manifest as changes in personality, moodiness, grumpiness,
Okay.
concentration, difficulty at work, difficulty at school, attention deficit. We hear a lot of it about attention deficit disorder.
Yes.
Anyone who's sleep deprived will have attention deficit disorder, whether they're sleep deprived because of lack of sleep or lack of functional sleep.
Okay, I see. So
And-
obviously it's tied to a lot too, and it's very, very important, sleep, obviously, Dr. Hoffman. So thank you so much for these great tips and for letting us know about, how we can try to achieve that good quality sleep. And thank you for joining us here at Virginia Medical Updates. My name is Alejandra Gonsalves, and we'll be happy to see you again with us next time.
Hello, this is Dr. Kavian Milani for Virginia Medical Updates. Today I have the privilege of introducing a very important book that came out in 2016. The book is by the psychologist Angela Duckworth from Wharton Business School. The book is called Grit. Grit is really a study of how it is that people have developed or can develop the energy, the focus, the purpose, the practice to be successful in different fields of endeavor. A book like Grit allows someone like me to focus and to see how can I, as a person who's busy as a physician or as a father or as a community activist, to focus and to bring my full attention and my full concentration to a task and take it to completion. So in a sense, Grit is an incredible book which I think is really a required reading for anyone who wants to be successful and wants to be able to make a meaningful contribution in this decade. So in general, Grit does study intention, it does study the mindset, it does examine the motivation and drive, and it does bring out some incredible things, some of which I'll share with you today, just to give a glimpse of what kind of outcomes can you expect in this book. So it turns out that of all forms of motivation, the best motivation is one that is derived from the within. So the self-motivation. So let's say, for example, someone is laying bricks. They're laying bricks, and there are three people that are laying bricks. One person is laying bricks, and you ask them, well, what are you doing? They say, I'm building a wall. The second person you approach and you say, what are you doing? They say, well, I'm building a church. The third person is approached and he's asked, what are you doing? He says, I'm building the house for God. So basically, one is kind of a job, one is a career, and one is a calling. And the person that can envision themselves, that engage in the calling, is really going to be much more successful and is going to be much more dedicated and much more devoted and much more focused and can actually deliver outcomes. And this book has the exact methodology that people can apply and use and study in terms of getting to that focus point. It turns out that a lot of people have a goal, they have an idea, they pursue a goal for a number of years, and they let go, then they go to the next goal and to the next goal. Whereas if you look at people that are the most influential and most effective in history, like the list of the top 100 most influential people of all time, between the number 1 and number 100, there's really no difference in IQ. The difference actually is mindset. The top tier IQ is 146, the lower tier IQ is 143. But the difference between these groups is not the IQ, the 3 points, which is basically negligible. The main issue is how these people focus, how these people bring themselves to the resolution of tasks, and how they begin to problem solve. So the key issue is motivation, purpose, and practice. And the practice is really important. And this really intertwines with another book that I did introduce a few months back, which was the book that's called Peak. So this book really, in a sense, complements Peak. And even though that book by Professor Erickson and his co-author really examines the issue of how to bring out your best in every situation, Grit really has a different methodology and approaches the same topic with a different language, and the language of grit. Now, the two authors, of course, know each other, and they've done a lot of work together. But something that is important in all this is that when people achieve that level of attainment, and they are really good, then they are in what is called the zone. And being in that zone where there's a flow, and that flow is really the same thing as the grit. So the grit is kind of how you get there, but the flow is the outcome. So this is really a very interesting book and really explores the psychology of success and the psychology of perseverance, and it is really a very interesting book, and I highly recommend this for anyone who wants to have a new approach to basically an old problem, how to get the best out of yourself.